quality assurance and accreditation of medical schools worldwide for the obvious reason that the medical profession deals with life. The Medical and Dental Council of Nigeria is the regulatory body for the practice of medicine, dentistry, and alternative medicine in the country. Over time, however, the quality and attitude of doctors have thrown up questions such as whether quality control is being ignored at the point of admitting practitioners into the profession. Answers to these and other matters arising as we beam our searchlight on the Medical and Dental Council of Nigeria. Acupuncture is a form of alternative medicine that originated from China. It has since become a global trend, and countries which are aware of the huge difference it makes in the management and treatment of diseases and other health challenges are embracing it. You will get to know more about this complementary medical practice and why Nigeria should not be left behind if you join us on Nature Scanner. Do you know the reason for the phrase, sleep on it and you will see things differently in the morning? That's because our brain cleans up while we sleep. I advise you not to miss out on our highly beneficial health tips on sleep. Welcome to the program. I am Rabi, Abdallah. Before we get down to our discussion on regulation and quality assurance in the medical profession, let's get the views of Nigerians.
Sometimes when you go to the hospital with a patient, and instead for them to attend for you attentively, they will not do that. And before you know, one or two things will just happen. You may have lost a patient that you took to the hospital, just like that. It's been happened to me. I took my wife when she was pregnant to hospital for delivery. So after the operation, we lost the baby.
For me, it's for them to go for more training. Every equipment they need for patients, Nigeria should get it for them.
Well, I think they should follow the rules and regulations that guide the practice of doctoring. They should try to follow it up accordingly in an honest way, and they should not be biased in any way.
It's one of the ethics of their profession to be very welcoming and very lively and kind to patients. You know, I will say it based on the ones I've met. Honestly, the Nigerian doctors I've met and the ones that I've come across are very nice to me as a patient. They are nice.
With me in the studio to discuss regulation and quality assurance in the medical profession is the Registrar of the Council, Dr. Tajuddin Sanusi. Dr. Sanusi, welcome to Health Options.
Thank you very much.
Okay, yeah, like you've heard, the focus is regulation and quality assurance in the medical practice in this part of the world. And we're beaming our searchlight vis-a-vis the importance of the medical profession. Can you let us into some of those things you do to ensure quality assurance before we get down to the nitty-gritty? That's to find out if they are working or not, because there are so many issues arising.
Thank you very much. Medical and Dental Council of Nigeria is a creation of the law, CAP M8, lots of the Federation. It was first enacted in 1963 by an act of Parliament, though it has gone through many amendments, and latest of which is the CAP M8. And we are saddled with responsibility of one, determining the knowledge and skills to be acquired by people wanting to become medical or dental practitioners in the country, to register them as such, and again to put up code of conduct for respective medical or dental practitioner. By the 1992 amendment, the control of clinical laboratory practice clinical laboratory, and I mean clinical laboratory premises, was actually added to the functions to be performed by the Medical and Dental Council of Nigeria. And in essence, what that means is, you know, our degrees are awarded by the universities, and the degrees are both academic and professional. Academic in the sense that institutions wanting to train medical dental practitioners will need to seek for NUC accreditation in the first instance, so that the academic content will have been seen to be okay. Then the other aspect is the professional aspect, skill acquisition, and that's why Medical and Dental Council of Nigeria is very, very active, in the sense that, you know, the teaching hospitals are established to service the universities, training doctors and other people in the allied profession. Okay. In essence, the teaching hospitals are the laboratories for the medical students. And that is why when we do our own accreditation, our focus is more on the teaching hospital, though we still focus on the academic aspect, the qualifications, so that they have the right qualification, training, to be able to train people. Of course, you can only give what you have. You can't give what you don't have.
We've had series of misdiagnoses emanating from our doctors. We have issues of quackery. We've had just recently, somewhere in Lagos, within the vicinity of the Lagos University Teaching Hospital, a primary school dropout was discovered to be running a clinic and being referred to as a medical doctor. How did such ever come to be?
Thank you very much. First and foremost, if there are no complainants to Medical and Dental Council of Nigeria, there's nothing we can do, because we cannot be a judge in our own cause. That's number one. The other aspect, which is the quackery. Frankly speaking, by our law, we have nothing to do with quackery. However, when quacks are caught and they are charged to the court, we come as prosecution witness. That is what we have as far as quackery is concerned. We know over the years, some state government have been very active in this respect. Let's take, for instance, in Lagos State, they have a body called a farmer. What they do is to regulate the facilities, because when you look at the health system, it's usually on the concurrent list in the Constitution, meaning that the federal, state, and the local government can dabble into it. And what we do in our own case to regulate the registered practitioners, to register people whom we think had the requisite qualification and skill to practice as such. But for the facilities, the state have the power to determine the levels of facilities you can have to be able to operate in your own state.
Don't you carry out inspections of facilities?
By law, no. We are not supposed. By law, okay, we regulate practitioners. The only time when you see us in facilities or get into facilities is when we do accreditation for the medical schools. That's in the teaching hospitals. Despite that, MDCN is ever ready to network and partner with the state. And for the sake of education of the populace, by our council, by the education of our council, every director of medical service or director of health service in each of the states of the federation, including the Federal Capital Territory, is represented on our council. And therefore, they are expected to be our eyes in their respective states. Whereas, where they have any problem, they can always draw our attention to it. Then we'll come in, we solve that problem. Okay.
Now let's take a look at how you ensure that people who go into the profession are psychologically prepared, they are adequately equipped academically and otherwise.
Our medical schools are part and parcel of the universities. MDCN does not have any control over admission. Every university has gotten its requirements, and therefore, if you meet up with the requirements, then you are offered admission. However, I know there have been agitations over the years that in addition to that, there should be an oral interview for prospective medical students to know whether they are psychologically prepared to undergo that training, because that training is totally different. In the sense, when we were in school, locally here in this country, the first 3 semesters is semester run. Once you pass your professional examination, you don't go on holidays. It's only in December they give you 1 or 2 weeks throughout, because the program is there. They already know when you are going to graduate. 6 months program, 3 months program, they are continuous. As you change from one posting, you move to the other. So doing that, in most cases, most of your thinking will be patient-centered. And that is why, as part of the requirement, there must be clinical student hostel in the teaching hospital. Clinical student hostel in the teaching hospital, because that is where the skills are acquired. When you are on call or you are at an emergency, you may be called at night that this is an interesting case for you to learn, so that when you are confronted with the life cases and you are the only medical officer there, you know what to do.
You should be able to cope.
You should be able to cope.
Okay.
Of course, they used to say when we were in school in those days, they say a good doctor is the one who knows what he does not know. So nobody expects you to know it all, but you should be able to stabilize the patient up to a point that you now refer to whoever you think can manage the patient better or have the better skill.
That's for those who, had always maybe had the ambition of studying to become a medical doctor. What about people whose parents forced that course on?
That's why I said that in this agitation that before prospective medical students are finally admitted, there should be what we call oral interview to know whether these people are actually prepared, because the training is very rigorous.
But if you have that in place, how comes we've been having such people.
Thank you very
As a
much.
health correspondent, I've had interactions with doctors who said if they had their way, they would have been doing something else.
Let me tell you one
not
thing.
for their parents.
Thank you very much.
So what kind of commitment or expertise do you expect from such?
We are not the one operating the medical school per se. The onus is on the...
No, but you license them to practice.
I'm coming. You see, for the admission, it's the university that does the admission. So, we have proposed, we have advised over the years. But again, they have the expertise, they have everything. Our belief is they spend a total of 6-7 years. Before you actually finish your program, you will have been tamed in such a way that everything you do, you will be patient-focused, thinking about the well-being of your patient. If you are stubborn before and you come into medical school, by the time you are even coming out, people will see the difference.
Okay,
that this person, yes, because at that particular point in time, the patient sitting before you, seeking for your attention due to ill health, is vulnerable. And therefore, there are some informations, especially for spouse, informations that cannot be released to their spouses, they will release to you as a doctor. And that's why the issue of confidentiality is surely very paramount in our ethical conduct.
So you mean you have all it takes or all is needed to be put in place to ensure that we're not just having an avalanche of foreign trained doctors who just went there for the sake of, going through medical school abroad and coming to just get inducted into our medical profession back home.
Thank you very much for that. You rightly said initially that the exam for the foreign train became very controversial. It has to be, because every country has gotten its own standards, okay, and we have our standards. And that is why Section 9 of our law that says that we must institute assessment exam for those with foreign medical or dental qualifications. And that is what we are doing. And to ensure quality control, now we move around from accredited teachers to another one. But no, what we do now is to bring external examiners from all over the country together. They set these questions. The student or the candidate, I won't call it student, they are candidates. They sit for the exam. after the paper one, they go for the first component, then they move to the other one, which is picture test. From picture test, they go to OSCE. From OSCE, clinicals, orals.
Yeah,
so there are many components.
You have such processes in place
already now
to ensure quality.
Quality control.
Okay, so thank you so much, Dr. Tajudeen Sanusi, for coming on Health Options.
You are welcome.
Thank you for having
Thank you very much.
Our Nature Scanner beckons, where we take you to the world of acupuncture.
Acupuncture is one of the alternative medical therapies in traditional Chinese medicine. We have traditional herbal medicine, we have tuna therapy, we have microacupuncture, and we have Qigong, Taji Chuan, and many others. Basically, all the elements you can think of can be treated by acupuncture. It depends on where and how, or the expertise of the acupuncturist. You can use different methods, particularly migraine, stroke, arthritis, convulsion, epilepsy, and many others, including infertility, pelvic inflammatory disease, all joint pains of all kinds, headaches of all kinds, especially non-surgical problems. Because acupuncture cannot restore what has already been destroyed, but it can bring back the harmony in the system so that the system can function properly. The traditional method is the traditional needling technique, which there are different sizes of needle. As we have some of them here, we have the traditional needles. There are different types, and this type of the needle depends on the size of the person and the heftiness of the person. The needle are stuck into a particular well in the body. It's not arbitrarily inserted. Each needle is put into a particular depth of length and at a particular angle. We have what we call also microacupuncture. Microacupuncture are specialists of acupuncture in the regions of the hand, which is the hand acupuncture. Then we have the ear acupuncture, which we also have the foot acupuncture, and we also have the scalp acupuncture. All these are various branches of acupuncture, which we call the microacupuncture. You can use any of these particular organs or regions of the body to treat the whole elements of the body because they represent the body. Like, for example, the ear, if you look at it carefully, it's a baby in the mother's fetus. It's a fetus in the mother's womb lying upside down with the head here, with the backbone here, and the limbs, outer limbs, and the inner organs around here. So when a person has a problem, it will be reflected on various regions of this body, various parts of this ear. And you can use special technique to trace where the more sensitive areas are, and therefore needle those to cure the condition of the person. And you can use all kinds of elements to be treated with this. But more effectively, all cases of addictions are very effectively treated with ear acupuncture, especially drug, alcohol, and nicotine, tobacco addictions are very, very effectively treated. You can also treat other conditions with it. The same thing with the hand, the same thing with the foot. If you look at the feet, you can see various organs of the body are also represented here. And these various parts of the body represent the various organs. And if you have sickness with any of these any of these organs or any of this system, it will be reflected on that part of the body. So it can be used, we can use those parts of the body to treat the condition. So you can use multiple or single, any one of them you choose. But the regional part of the acupuncture are the one what we call microacupuncture and microacupuncture specialists. There are new tools now for detecting and treating conditions on these parts of the regions of the body. But the one which is now latest is the laser. This is the laser technology. There are two different laser means. We have the red laser, which is deeper, and then we have the blue laser, which is not very deep. This one can go as deep as the bone, and this one can stop only on the muscles. And each one of them have the same effect like the needling technique. So, but because this one is is faster and takes less time, because you only shine the laser beam only for 30 seconds. And this one only for about 2 minutes or 3 minutes at most. While the needling technique takes about 25 minutes. After inserting, you have to leave the needle for 25 minutes. So the pricing is different. If you are going to go for treatment, if you have the means, you can go for the laser. If you don't have much, you can go for the electroacupuncture or even the traditional method. Or if you don't want all of this, we have capping too. Acupuncture is really very affordable, safe, and virtually no side effect if it is done by a person who knows how to do it.
Interesting, isn't it? Now you know the wonders of acupuncture. What is your nightly sleeping habits like? Do you know that it is during our nightly 7 to 9 hours of sleep that we have the best recuperation capacity, which is essential for our health and well-being? Let's now join our experts for more health tips on sleep.
Okay, sleep is something that is natural, given to us by God, and it's meant to rest the brain, rest the body, build the body's immune system, and make the person refreshed after sleeping. Basically, this is what sleep is supposed to achieve in our body. And when people don't sleep, there are certain consequences. Starting from the brain, they have difficulty in concentration, they have difficulty in passing judgment, so they cannot make decisions, they cannot function properly in their capacity, so they will also have forgetfulness. They will also get drowsy, which we call daytime sleepiness, and as a consequence, that means they are more accident prone. Also, it affects the immune system in the body, so the body is not able to fight infection. The other things that are affected, like they are more predisposed if you don't sleep adequately to heart attacks. So they can have also high blood pressure. They're also predisposed to diabetes. Okay. Other things they can have is difficulty in balance, and because the immune system is low, they have more chances of having recurrent infections. So they may be having more higher rates of things like malaria getting into the system. It is true that it's better to sleep at night, but what is much important is the total sleep hours per 24 hours. Usually we encourage that people will sleep between 6 to 9 hours. Anything in the excess of 9 hours is also not good. And we don't want people to sleep for less than 6 hours, depending on the age. But the best time to sleep in our own environment would be to sleep, go to bed probably at 10, and then they're able to wake up at about 6 a.m. The best time to rest is when you are less busy and you're not at work. So there is no clear-cut timing for sleeping per se. You can sleep at any particular time, but like I said, the total hours of sleep is very, very important. For example, if someone sleeps in the afternoon for 3 hours and sleeps in the evening for 4 hours, the total sleep hours of that person is 7 hours in that 24 hours, and that is relatively good. We will talk about things that would distract a patient if he's unable to sleep. For example, putting a television in the bedroom, for example, when the person is supposed to be sleeping, this can cause a problem with sleeping. If the person is supposed to go to bed at 10 and he waits till like 1 or 2, it's reading a novel, is having things that would distract him, working on his phone, browsing on the phone, internet, and things like that. These are the things that would distract the patient. And for such patients, we may not need to give them drug. We'll just give them some lifestyle modification, and that will help in correcting some of these sleep disorders. Doesn't necessarily mean that they will need drug to make them necessarily sleep. The other thing is about people who do shift work. Now, they don't sleep at night, and during the day, they go on not sleeping also. So for such people, you need to correct such anomalies. So during the day, they must find time to sleep for like at least 6 hours during the day to compensate for the loss of night sleep. So if they don't do this, over time, they develop some difficulty in sleeping. And so for this kind of people, we just correct it. So the correction process is what we call like the sleep hygiene, trying to correct the sleep anomaly in these people. Melatonin is something that is natural. It helps people sleep better. However, if melatonin is lacking in the body, then melatonin is natural. Everybody has melatonin. However, in some people, it may be lacking or reduced, and so you may need to boost the melatonin level to help the person able to achieve sleep. When people don't sleep well, then they are predisposed also to stress. And of course, stress will give them fatigue, and they go around hospitals thinking they are really sick. Whereas the primary problem is just stress, because they are not sleeping well, they are mentally fatigued. Of course, they cannot think well, they're having poor concentration, they cannot function properly in their offices or where they work. So the optimal treatment is not to go on giving them drugs or pain relief, but is to get them to achieve significant sleep. And with that, some of the stress and the fatigue will improve. If you don't sleep, you don't rest the body. And if you don't rest the body, then you should expect poor functioning of the body, poor outcome, and stress and other things, other concomitant diseases like diabetes, heart attack, hypertension, low immune system. These are all the things that sleep is supposed to help the body replenish. And once you don't sleep, then you should be cut out for some of these things.
This is what Health Options is all about, a platform that helps you to make informed choices for better health. As we round up this edition of the program, remember that you can go to our YouTube channel to watch the upload of these and other episodes, and email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. Thanks for watching. Bye for now.